Good morning, everybody, and thanks for being with us, those that are here in person as well as those that are virtual today. It's exciting for us here at the Lebanon VA to be able to unveil this new technology that we've been able to purchase here for the care of our veterans. This is the Da Vinci Xi surgical system. It's been used in the community for many years, and this is the newest, latest, and greatest one of their machines. We're blessed to be able to recruit some highly qualified surgeons who've been able to use this technology in the past in the community, and now they've brought their skills here. One of them is in the room today, is Dr. Brian Pilkington. He's been doing robotic surgery since 2014. Dr. Tom Clements is another one of our surgeons. He's actually on his way. He got tied up with a patient. And, please, we'll have Dr. Pilkington demonstrate the machine, as well as take any questions you might have about it.
Hi everyone, I'm Brian Pilkington, and was privileged to join the VA in January, this past few months ago, after 33 years of Good Sam in Lebanon. And one of the reasons I came was to help our veterans with robotic technology. As you can see, the Da Vinci, which is over here, is an Xi system. It's the most modern robotic surgical system on the planet, and we're privileged to have it here at the Lebanon VA. This part of the machine is the patient part, and actually where the patient, our little light plastic thing here, is simulated. So the arms of the robot basically have instruments that go into the body and enable us to do surgery minimally invasive. This part is the vision part, which is demonstrated. It's all the electronic guts of the entire computer system, along with the TV monitor. This is key as it has high definition and zoom capability, and really gives the surgeon a 3D view of the operative field, which is unmatched in any procedure. The surgeon console here is where the surgeon does his work. Through these manipulations, we are controlling the robot. The robot does nothing without the surgeon's touch. So I'll briefly demonstrate, just grabbing a few micro things in there. So if we wanted to pick up a ring, the ability of the robot as opposed to laparoscopic, you can see the wristing of these instruments, the tools. Mimic the human hand actually can turn in further degrees than the human hand can, as opposed to singular laparoscopic instruments which have no wrist and are just like straight sticks, we call them. You're trying to dissect things and grab things that are straight. Whereas here I can come around corners very easily, pick things up, down. And this enables us to dissect out blood vessels to 360, and perform cancer surgeries, gallbladder surgeries, hernia surgeries. Dr. Clemens is going to be doing our first robotic surgery next Friday, and that's going to be kidney surgery. So there are multiple uses for this, both in urology, general surgery, gynecology, cardiovascular, and if you look at the zoom capability of this, you can really see every detail, and it's quite remarkable. So, thank you very much. Appreciate everyone. Is there any questions from our virtual audience?
So everybody that's online, thank you so much for joining us today. Please stop by and see us in person as soon as you can. Again, we have a lot of great things here to offer at the Lebanon VA, not only in surgery, but across all of our medical specialties as well. So thank you once again.